Hi, Ryan Steinolfson here with Business Trends TV, and today I have Dr. Stephen London with us online. And as you know, with Business Trends TV, we are interviewing the businesses and business owners that are setting trends in their respective industries. And Dr. London is definitely one of those people. Dr. London, Dr. London, what other questions do you get a lot of? Is there any other questions that you get a lot that people should be asking, but they don't know to ask you? Because they're not a specialist, they're not a dentist like you. Is there anything that kind of comes to your mind right now?
Well, something that periodically comes up that you want to be sure of is the cleanliness of an office, the sterilization of instruments, and you can get a very good feel of that from the very moment that you walk into the door of that office. You should see that the place should look pretty immaculate. There should be everything, floors, counters should be clean. That'll give you a good feel for how that office is kept. And you may ask to see their sterilization area, to see what kinds of devices are used to sterilize equipment. Most offices have what is called an autoclave, which is basically a steam chamber where instruments are placed under pressure, and that is what sterilizes them and gets rid of all the bacteria. So you want to be sure that this is taking place. I mean, in 2013, that is absolutely the standard of care. Instruments, when they come into your room, if they're ready to treat you, they should be wrapped up, whether they're wrapped up in a bag or wrapped up in another cassette or something of that nature. They should not be loose. They should be coming out of some kind of wrapping. And you should ask these questions if you are concerned, because it certainly is a big concern.
Yeah, so look to make sure that that office that you choose to go with or are interviewing to see if you're going to go with them, look to see that they have proper sterilization techniques. Make sure that any of those, when they're even cleaning your teeth, make sure that they're using tools that are coming out of a bag, which would show that they're actually sterile and they've been treated in an autoclave or something like that in order to sterilize them and remain germ-free. Because that's, when you're dealing with gums, I mean, you can just reinfect an area possibly by using a tool that might not have been properly sterilized. I take it, right?
So these are, again, very important. Most offices should be up to date on that. Other questions people ask about technology. There's as people know, technology today is like it's never been before, and in dentistry we have quite a bit of technology available to us. Starting from digital X-rays all the way through to what I have is called a CEREC machine. It actually allows me to make a crown in one visit. So a patient comes in, it's called a CAD/CAM machine. It actually lets me take a picture of the tooth, and then it has another machine that actually makes the crown while the patient waits. So they don't have to come back a second time. They don't have to wear a temporary. There's no impressions. So it's pretty amazing technology, and there are offices out there, some offices, not a high percentage, but there are certainly offices that have this type of technology, and it might benefit many patients, especially people who are have very difficult times getting away from work or just finding the time to make multiple appointments. It's a very good way to get a treatment done, a common treatment being a crown, where you don't have to come back in for a second visit. Very convenient for somebody who has a very, very busy schedule.
You know what? I didn't even know that. I didn't even know that was an option. That's really a great point that you just made there, because I've gone to my dentist a couple times and I had to go back a second time in order to get that crown after it was actually made. Right. So I appreciate what you're talking about, because my time's very valuable to go and be out of another half a day, because let's face it, by the time I go see a dentist, I leave from where I'm going. It takes me half an hour to 45 minutes to get there. I'm there for an hour. I go back a half an hour to 45 minutes back to the office. A half day's gone, minimum. Right. So that's very important for me in particular, and most other busy business people or people that have jobs. So
moms,
I think it's
many busy moms who are busy taking kids to school, picking them up from school, taking them after to all these activities. So there are people all have all types of busy schedules today, and it's just a nice a nice way of being able to do a very common treatment that we do here in dentistry, in just one visit.
That's awesome. So it's called a CEREC machine. So ask specifically if the dentist has what's called a CEREC machine.
CEREC, yeah, that's CEREC. It's probably of all the machines that can make a crown in a day, that would be the most popular one.
Okay.
And yeah, that's something you probably can find that information on a website, dentist website, if they have that technology available to them.
Great. And then what other questions what other things, is there any other things that you'd recommend that people look for in a dentist, or is there any final parting words of wisdom that you'd like to leave us with?
Probably the final word is when you actually find that dentist, after looking at their reviews, after seeing their website, looking at their reputation and experience, you then have to evaluate how the visit actually goes when you first meet the dentist, when you first meet the staff. You want to form your opinion and see, how are they treating you? Are you going to get along with the staff, with the dentist? Do you connect? Because, if there's a disconnect, that's probably not the place for you, because if you need treatment, let's face it, you're going to be there for quite some time. For whether it's one visit, whether it's several visits, you want to be sure that you're having a connection with that dentist and with that office. Yeah.
So make sure that there's a connection there in terms of just being able to relate with them personally, and then potentially, and just make sure that you're able to communicate with them effectively, and because ultimately it's a long-term relationship, just like anything else. So you want to make sure that you can connect with that doctor, and they're listening to you, and they're engaged with you, and they have time for you, I think, also too, which is good. So awesome. Well, if somebody does want to get a hold of you, what's the best way for people to actually get a hold of you? I think that I'm actually going to put this up here. I think this is your is this the best way for people to get a hold of you? Is Stephen London DDS?
DDS.com. And also you have the number on there, which of course 561-922-0911. Again, they can call the office. They can look on the website. Again, read reviews. That's very important.
Yep, it is. So if you want to get a hold of Stephen London, Dr. Stephen London, he's in the Boca area. You can just Google dentist or cosmetic dentist Boca Raton. Most likely he'll come up on the maps there, and with his reviews, you can see StephenLondonDDS.com, 561-922-0911. Thanks a lot, Dr. London, for meeting with us today, and maybe we'll get another hangout recorded here in another maybe 2-3 months to talk about maybe a new treatment that you have or something else to further educate your potential clients and other people out there that are looking to find a good dentist.
Absolutely, and thank you for having me.
Okay, thanks, Doc. Okay.
All right, thank you.